And can everybody
There's no fish. We only got 20
okay?
fish.
Are you able to see the first slide, Guiding Principles, Chapter 7 overview?
And she's like, oh, just kidding.
Thank you.
So
I'm going to go ahead and put everybody on mute until we have a discussion, just to help the quality of the recording for folks that aren't able to attend today. So just stand by, and if you need to unmute, just raise your hand or chat in the chat box. But I'm going to mute everybody. So today we're going to talk about Chapter 7, which is the Guiding Principles. This was quite a bit of information for one chapter. I began to dig in and felt a little overwhelmed. So much information to cover, so many things to digest. So I just tried to take the most important concepts and put them in this presentation, and then hopefully we can have an open discussion after I get through these few PowerPoint slides about next steps. And I want to provide a few examples to you guys during today's session so that you can know how to build your CHW portfolio, per se. So we'll go ahead and get started. So today we're going to talk about defining ethics for CHWs. I want to start by going over the Community Health Workers Code of Ethics because that was created with community health workers in mind, and I know you guys went over it in the chapter. So I'm just going to do a really brief overview of that so that you guys can basically comment if you need to and ask questions as deemed appropriate. So I'm going to switch to sharing screen 1. And can everybody see my screen now? No? Okay, you can. Okay. So basically, the purpose of this code of ethics was to provide a framework for community health workers, supervisors, and employers of community health workers to discuss ethical issues facing the profession. So this is some preliminary work to help you guys understand what's expected of you and how you can protect yourself. And I'm just going to check the chat box to make sure we're all good, because I can't see you guys when this is up. So Article 1 states responsibilities in the delivery of care. We need to deal honestly. We need to be honest, provide confidentiality, scope of ability and training, quality of care, referral to appropriate services, know our legal obligations, and then promotion of equitable relationships. We need to practice cultural humility, maintain the trust of the community, have respect for human rights, practice anti-discrimination, and protect our clients' relationships by providing respect and actively maintaining personal boundaries with our clients. Article 3 is about interactions with other service providers. So we want to cooperate with everyone that we work with and place the well-being of those that we serve above personal disagreements, and work cooperatively with other people or organizations dedicated to helping provide care to those in need. We also want to be mindful of our conduct and respect people's rights, dignity, and worth of all people. And we want to report inappropriate behavior or things that would make us feel uncomfortable or concerned for someone else's safety. We want to present ourselves well and be truthful and forthright in our background and training to other service providers. Article 4 states we will have professional rights and responsibilities. We will remain up to date with our continuing education. We will advocate for change and work on impacting policies that promote social justice and hold systems accountable for being responsive to communities. We will enhance community capacity. We will promote wellness and safety, and we will have a loyalty to the profession. We will advocate for community health workers and recognize others. So that's just, that really summarized very quickly, but I wanted to go over that, and it's pretty important for us to know the, thanks, Giuliani, I've got you. We want to know what our code of ethics is as a community health worker, because it's such a new realm, even in the U.S. and especially in Alaska. So key ethical concepts is to provide confidentiality to our patients and also provide informed consent. Anytime someone's signing up for something, we want to be truthful with all the things that they need to produce to qualify for services. We need to let them know of any delays we might expect, and we might also want to have them sign a consent form that your organization might have on hand. If you don't have an informed consent form, please let me know, and I'm happy to try to get you all a template that you can customize and make applicable to your organization. But most of you working in the community health center setting should have an informed consent form. So there's a framework actually for ethical decision making, because you will be working with lots of people who will need your help in different realms. And so this is a step-by-step process for you to work with your clients. Basically, you will let them describe the problem or dilemma to you. You will think about your ethical guidelines or codes. If there's any applicable laws or regulations you need to take into consideration when helping them, you can do that at that time. You can seek consultation if you aren't sure how to help this client, or you need to reach out to another agency in advance of sending them. And then consider possible courses of action, outline possible consequences of decisions, and then decide on what appears to be the best course of action. So this is all taking into account when you're working with a client and it's not as clear-cut how you should assist them, and you have to tap into your own ethical decision-making. These are the things you should do to reach a conclusion. Because as you know, when you're dealing with people and you're in the role you're in, things could come back to haunt you if you don't do your research thoroughly and have a protocol when you encounter certain situations. So we also want to establish and maintain professional boundaries with our clients. We want to avoid boundary crossing and self-disclosure pros and cons. We always want to think about how, if we're trying to relate to someone and want to tell them a story about ourselves, there are pros and cons to that. A pro is you can possibly have a greater connection with them, especially if you've gone through a similar situation or know of one. The cons are you might be describing someone that they know, you're in a small community, and you need to be careful with confidentiality. So it's just really important to gauge when it's appropriate to do self-disclosure and at all costs protect the identity of others involved, just for your own protection. And so there, in Chapter 7, there are some considerations that you should go through thoroughly before deciding whether or not you should do self-disclosure with your client. And then we also want to perform self-awareness evaluations frequently so that we know where we are, things that might have impacted our views of things, and where we're going. So coming up with a good way to gauge, you know, what we believe, our prejudices and biases as we went through in the previous chapter, and then adapting to meet our clients' needs. So what is your scope of practice as a community health worker? I'm going to go ahead and take everybody off mute, and I would just really appreciate each one of you to participate and just take a look at some of the scope practices that I've listed below, and just tell me in particular, if you don't want to talk, you can chat in the chat box, but I would like everyone to participate and tell me what your scope of practice will be as a community health worker once you get through the apprenticeship program and you're certified. What will your role be? Will you be providing counseling, interpretation, and translation services? Will you conduct home visits, medication management for folks that might have chronic conditions? Will you do treatment counseling? Will you accompany clients to appointments? Will you facilitate training and education sessions, support group facilitation? What do you know to be your role in the future if you're not already doing it? And if everyone could just take about at least 5 to 10 minutes to talk through what your scope of practice will be. And even if you are just kind of dreaming up what you would like to do, I just like to gauge that from everyone. So I'm going to go ahead and take folks off mute. So everybody, you're off mute. So if you could just go ahead and speak up or comment, that would be great.
Here it is. This is Karen. I see myself doing home visits, facilitating group, working with people individually on their goals, and then following up.
Awesome. Thanks, Karen.
This is Lorna.
Hi, Lorna.
Right now I do home visits, provide transportation, outreach, and do community efforts.
Awesome. Anybody else?
Yes, this is Esther, and mine are the same as those, but I also go down to the school and do the short educational things for the kids, along with the fluoride, and do all the handing out of pamphlets and things. So not a total educator, but yes, some education, and the lots and lots of filling out forms for whatever anybody needs.
Awesome. Thank you, Esther.
Hi, can you hear me?
Yes, I can. Go ahead, Katie.
Hi, good afternoon. Yeah, I do everything those girls do and then some. I always have applications on board for food stamps, energy assistance, senior benefits, just a lot of variety of things, and keep the flow going through town.
Awesome. Thank you, Katie, for that. Anybody else?
Cherise?
Yes?
This is Kelly. I do all of those things as well. I even had the privilege of doing a medevac in a village once, so because there was no provider. So the scope of practice is kind of varies in each village, but you just have to play along. But I enjoyed every minute of it.
So you actually, Kelly, are responsible for more than one site of providing services to?
Yeah, we have 5 villages that I travel out to personally and get everybody enrolled in Medicaid, registration, sliding scale fee. And then I do all sorts of outreach and for our health clinic on what we provide and get people in touch with what they do. I scheduling all the providers on site, and then one time I was stuck in a village with only a behavioral health clinician, and we end up doing a medevac, so that was quite interesting.
Yeah. Well, thank you for that, Kelly. And I've noticed you guys say, well, I only do, but you guys are doing a lot. So it sounds like it's, you know, small amounts of work, but you're actually providing tons of services. So thank you. I just want to chime in and say Suriani commented she does outreach, home visits, patient education, helps set patients up with Medicare and Medicaid, referral help with regards to insurance. And one thing I forgot to put on the scope of practice is helping people connect with health insurance benefits. I know many of you all work in tribal facilities, and folks may not think that they need health insurance, but it's important to know about healthcare.gov and know that we are in a very expensive state for health insurance. So the more you know about that, the better. And I'm more than happy to help you guys learn more about health insurance, Medicaid, Medicare, because your patient's ability to pay has a lot to do with them maintaining their health and going to the doctor. So something to add to this scope of practice would be connecting clients with a form of insurance, one way or the other, or benefits that they might be, like VA benefits, they might be able to access to help cost coverage and effectiveness, because we don't want anyone to feel the burden of not having the ability to pay for care. So that's just one tidbit. And then looks like I've got a couple other things. Marty Goff says home visits are a goal of hers, outreach and facilitating training. Lillian Ford says advocate for patients and clients in my community. Lindsay says outreach, possibly home visits, transportation, and Medicaid, Medicare health insurance that I currently do. And then someone has their hand raised. Karen, did you have a comment?
This is actually Anne. I provide lots of translation for the doctors, for physician, and for psych, and also schedule appointment to them. And we also help, and I translate it for new people who need some insurance, Medicaid, Medicare, or Obamacare. Now it's a little change, but anyways, I translated both ways and help lots of people around.
Great, thank you, Anne. Awesome. Well, thanks everybody for participating in that. I also wanted to bring to your attention a great example that is actually a work in progress, and I hope I'm on screen too. But Lorna Osterbach, I'm going to toot your horn for a minute. Can everybody see this page up here that I've got? Community resource contacts. Can you see that okay? Great. So this is a work in progress, I'm told, but it looks rather thorough to me. This is a great document to start and have when we're thinking about our scope of practice and how we're going to help our clients. You can see that Lorna has everything from airline information, state of Alaska, court system, car rental, food, housing, essentials, emergency services. This is a very thorough list, and I would love to circulate this to you guys just as an example to see the things that you might be faced with and clients that might come to you and be seeking help. So I would encourage you to take a look at this, and with Lorna's permission, maybe I could circulate this following the class. So that you guys can maybe use this as somewhat of a template and provide this information to your clients, if not the whole list, just knowing and having it at your fingertips when you're, asked to help a client. So thank you, Lorna, for providing that, and I hope that you guys are all working on your referral list because it's a huge component of being a community health worker. And then Kelly Field says, we have these for our regions in each village. So thank you, Kelly. This is a very useful form. I'm sure you can attest that having this in your back pocket helps you get right to the source of things, and then not only having this list, but if you can go a step further and establish relationships with some of these entities or people on your resource list, that would be great too. That way you can tell your clients, well, I know you can speak to so-and-so at the Housing and Finance Corporation. Here's a point of contact. It's always great to have a point of contact. That way, if you ever have to follow up, etc., you can do so. So that is a great list that Lorna put together, and with her permission, I'd love to circulate that so you guys can take a look and build on your own. And if you all have any that you'd like to share with me, eventually I would like everybody to give me a similar list from your community, and I'll build an archive too. So back to our scope of practice. We've gotten through that, so we'll go on. So roles of CHWs within healthcare teams. You're going to be part of a healthcare team. You work in a healthcare setting. So you might provide outreach. You might do home visits, patient education and referrals, client-centered counseling and case management services. Communication with patients will be ongoing, and you'll have to have a way to manage all of that. So I would highly suggest that you have a client intake form, and I have an example of one right here that I'd kind of like to show you guys. But it basically talks about the date of an initial meeting, the client's primary goals, actions to take. You can rate what they will do with their health goals, any resources that you will provide to help them meet their goals, challenges that might get in the way, ways to overcome and resist these challenges, referrals provided, and next meeting. And this is just a sample form, but it would be great. It would be great if you guys could go ahead and develop this and have this. And if you'd like a template form like this, I'd be happy to circulate that too. But you can keep this in a safe place. It will have client information, so you want to maybe keep it in a locked drawer so that people can't readily access it, or just do your best not to put a bunch of PII, but it will be personal nonetheless. So you should just go ahead and do a better practice of keeping these documents secure as you're working with patients. So we're going to go on to self-reflection and next steps. So we're going to work on what you can do to prepare for meeting with various clients. Outside of the client intake form that I just showed you guys, what else do you think you could do to start tracking and processing new patients? Do you already have a system in place? And if so, would anyone voluntarily talk to us about their tracking system for dealing with new patients and follow-up? Any speakers?
This is Lorna. We have it, and we track everything.
Lorna, we're having a little feedback from you.
Is your speaker on?
Yeah, speakers on.
We have a tickler, and we track all individuals we work with. The data contact, we try and have 2 contacts minimum per month on the variety of the people. We also have patients in need, and so we have the dates that we make contact with them. However, sometimes it will be many more times than that if we transported them, what services that we provide, what services they would like. and we only actually do health and safety, even though they have other requests, and we try and match them up with someone else that could meet that. But that way we can see if we haven't touched base with this person, that they're in the gap. We need to figure out a way to provide services for these individuals so that we're meeting the needs of all the different individuals in our community and not just a set group.
Awesome. Thank you so much, Lorna. Anybody else?
Hi, Sharice, it's Kelly again. We have, every 6 months we go, every January, not 6 months, but we try to do updates every 6 months. But every January we travel to each of the village and do patient outreach where we do all the forms and to see if they apply for Medicaid. And every individual that does put in for it has a chance to win a round-trip ticket. So that alone right there is incentive for everybody to do it. And it's been working really well for our region. We had like over 800 applicants enrolled in the Medicaid, and we have like 1,200 beds. So
nice.
We're getting there.
Yes, you are. Anybody else have any systems in place? Well, I would like for us to take a moment, if everyone could, in the chat box, tell us as a group 3 actions you will take over the next 3 to 6 months to effectively help your patients in your new role as a community health worker. What are 3 things you're planning to work on to help put your system in place, track patients better, and follow up with patients better? Can we just take a couple of minutes and folks go ahead and chat in the chat box 3 actions you'll take to be more effective when dealing with your patients. Okay. So thanks everybody for participating. If you could, can you guys see the chat log? If you can, just tell me, and then I won't go through reading everything. Great. So you can see that lots of people have indicated they want to do more with tracking their patients, client intake forms, what else did people write? Having a better case management system. Oh, a newsletter with information. That's great. That's a way to keep consistency going and announcing your ability to serve the community. Make sure to check on the elders every month. Great plan. Yeah, so folks, this is all stuff to get your mind flowing and start thinking about your day-to-day in and out work as a community health worker. Maybe even getting with your supervisor to create a work plan. It can be implemented now or once you're certified, whatever your organization designates as appropriate, but it would be a good idea to figure out the direction that you guys are going to go in and being part of that healthcare center team. Adding some new skills to your belt if you don't know much about health insurance and connecting clients with that coverage. That's a good goal to set for yourself as far as effectively working with patients, because we know that everyone needs a form of coverage when it comes to seeking health services. So this is all great information for us to consider. I'm not sure if you guys got through all of your homework on Chapter 7, but there were lots of videos to watch. I would encourage you, if you can, please watch those videos. It'll teach you more about client intake and working within the healthcare team setting. I wanted to leave a little bit more time for you guys today to possibly wrap up Chapter 7 and go through those videos. One thing we also talked about last week, which now I can't remember the name of the document, but some of you sent those to me, was going through and talking about your, well, I don't think it was a referral system. Let me just pause really fast and see. Someone sent me an example I wanted to share and get some feedback from you guys on. Just 1 second, guys. I'm going to pull this up. Oh, okay. So I'm going to just pick on you really quick, Katie. Thanks for sending me your cultural humility plan. So I'm going to share screen 2. So I also want you guys, in lieu of creating your contact list, to do this cultural humility plan and have that available readily so that you can build that into your work plan when you meet with your supervisor, letting them know that you want to practice cultural humility and you guys want to come up with a plan and identify gaps and challenges, because they might know of some gaps and challenges that you haven't yet been faced with, and you guys can do some predictions on things that you might face. So please go ahead and work on this cultural humility plan. Also with educating yourself further about other cultures in your community. It's important for us to know our surroundings as a community health worker. So go ahead and do this cultural humility plan. It was part of Litmo's homework. If you already did it, great, but refer to this with your supervisor. Let them know this is part of your movement and that you need to incorporate this in your work plan. So really, that's all we have for today. I wanted to simplify Chapter 7 as much as possible because it was so much information to digest. But I wanted to turn it back to you guys and see if you had any key takeaways or questions on Chapter 7 that we could address here during class. And if folks don't have anything further, I'd like to give you the rest of the time to review all the videos in Litmos with all the interviewing and things like that. Okay, Suryani, I will get with you on that, and I will email you the chapter. So you're very welcome. I'm sorry we've had a delay with getting that. It's a long story, but we'll chat after about it. Was there anything else, guys? Otherwise, I'd like to go ahead and end the class early and direct you to Litmos to watch the videos if you haven't already done so. So homework is to watch the Chapter 7 videos because there's a ton, and then review Chapter 8, and we'll join back here next week at 1 p.m. on the 26th. So go ahead and log into your Litmos account and watch the videos that are related to Chapter 7 if you can for the remaining 20 minutes of the class. So thanks everybody for attending, and we'll give you this time to finish up Chapter 7 videos. Take care.